Hypothesis: MLT technique can improve immune response in human body. Said Safar Musavi, Manual Osteopathy Therapy Program, May 5th, 2023. Abstract: Immune system protects the body from infection. It is composed of white blood cells, antibodies, and other components including organs and lymph nodes. White blood cells, or another name is leukocytes, are formed in bone marrow. WBC T cells grow in thymus and lymph nodes, and B cells in spleen. According to Bulletin of Atomic Scientists, there are an estimated of 10 million people living with a compromised immune system in the United States. Lymphocytes can consist of T cells, major killer cells, and B cells to protect against viral infection and produce proteins to help body fight an infection, which are called antibodies. In this case study, I'm going to show the efficacy of manual lymphatic therapy treatment applied to client. I do strongly also believe more studies have to be done in larger range of people. Introduction. Immune system consists of many parts that work together to defend the body against invaders. The primary parts of the immune system including the bone marrow and thymus. The bone marrow is extremely important to the immune system because all the body cells, including T and B lymphocytes, originate in bone marrow. B lymphocytes remain in bone marrow to mature, while T lymphocytes travel to thymus. Parts of the immune system are as follows: mucous membranes in nose, throat, bladder, genital, tonsils, bowels, bone marrow, lymph nodes, skins. T cells multiply in thymus, differentiate into T helper cells and T cytotoxic cells, and acquire different antigen receptors, various proteins, for example CD4 and CD8, which are expressed on the T cell surfaces. After T cell and B lymphocytes have matured in the thymus and bone marrow, they travel to the lymph nodes and spleen, where they remain until immune system is activated. The role of the spleen is to filter blood cells and entrap damaged red blood cells. The spleen serves as a storage for platelets and WBC. We have also MALT, or mucosal associated lymphoid tissues, and GALT, gut associated lymphoid tissues, which play a vital role in the immune system. They contain lymphocytes and macrophages that defend against pathogens attempting to enter from outside of the body. Immune cells. WBC cell. We have different kinds of the WBC types. One of them is neutrophils, help protect body from infection by killing bacteria, fungi, and foreign bodies. Lymphocytes, which consist of T cell, B cell, and natural killer cells, protect against viral infection, produce protein to help body fight infection, which are called antibody. Eosinophil identify and destroy parasites, cancer cells, and assist basophil with allergic response. Basophils produce an allergic response like coughing, sneezing, or a runny nose. Monocytes defend against infection by cleaning up damaged cells. T cells types. There are two T cell types: cytotoxic T cell, which destroy infected cells. Helper T cells send signals that direct other immune cells to fight infection. B cells, they make protein called antibodies to fight pathogens. Cytotoxic T cells, they are also called CD4 8+ cells because of having CD4 receptors on their membrane. Cyto means cells, toxic means poisonous or harmful. Cytotoxic T cell kills cells infected with virus, bacteria, and destroy also tumor cells, which play a very significant role in the tumor fighting treatment. Other types of the T cells, one of them is regulatory T cells, or another name is suppressor T cells, which prevent T cells from attacking your body healthy cells. Effector cells. When the T cell locate the threat in the body, they copy themselves, making more T cells to defeat the invaders. These T cells that join the fight are called effector cells. Another one is memory cells. Unlike the effector T cells, memory T cells are not fighters. Instead, they remember the intruders so that if it returns to the body, your immune system recognizes it and quickly mounts a defense. Where T cells are located? First is in bone marrow. They start in bone marrow and mature in thymus. So the second location is thymus, and also lymph tissues and blood stream. And finally, they relocate to lymph tissues or blood stream. Disorder related to T cells, or the diseases related to T cells. Most of them, they are autoimmune diseases such as acute lymphocytic leukemia, adult Hodgkin lymphoma, T-cell lymphoma, chronic T-cell leukemia, or DGeorge syndrome, and HIV, Wiskott-Aldrich syndrome, thymic aplasia, severe combined immune deficiency, or SCID. What are the signs of a weak immune system? First is constant cold. Getting 2 or 3 times cold per year is something normal, but if you get more cold, more than this, so you get frequently cold, it can be a sign of weak immune system. Fatigue or exhaustion. Sure, everybody feels a bit lazy from time to time, but if you find that you are struggling to stay awake, so it can be a sign that your immune system may be compromised. Increased stress levels. According to American Psychological Association, long-term stress and loneliness can have a negative impact on your immune system. Stress lowers your lymphocytes levels. It means that it can reduce the number of your lymphocytes. Digestive tissues. Diarrhea, gas, bloating, cramping, and even constipation can be some signs of the digestive problem. What are the risk factors? Some of the risk factors that it can be smoking, alcohol drinking, poor nutrition, chemotherapy, infections such as flu, monocytes, measles, HIV, or AIDS. This case study is about a female client who is in 50s. She is a supervisor in a very fast-growing company of IT management. She is under constant stress to complete the projects on time. She is a mother of 2 kids, teenager with a 2-year gap, with a 2-year gaps between the kids. Both kids are in puberty period, and she has lots of challenges with their puberty changes. So she complains lack of energy or feeling very exhausted, and also lacks of concentration, and she cannot concentrate on her work or on homemaking as well, and also digestive problems such as stomach cramping, gas, and diarrhea. Methods. The comprehensive details of informed consent were reviewed for the client, and she was informed that the results and her identity will be kept secret and also confidential. The short and long-term goals were explained to client, and they were documented in client chart along with assessment results. The MLT treatment process are as follow. First, we do as usual a global assessment, and also the lymph node assessment, and also MLT contraindications such as active viral infection, fever, acute bacterial infection, risk of embolism, blood clot, acute aneurysm, cardiac insufficiency, etc. were also ruled out. So we do the MLT on a healthy person or client. The MLT technique, which can be applied for a low immune system, is the whole body MLT or the upper body. By performing MLT, actually we are facilitating the flow. MLT should be very gentle, steady. Strokes used to move lymph need to be repeated several times and in a constant rhythm between 3 or 7 times, and also proximal to distal. MLT techniques that we use are as follow. I use the whole body MLT. So I start with the supraclavicular lymphotome, respectively, from terminus, clearing terminus, supraclavicular chains, spinal accessory chain, jugular chain, superior deep cervical nodes, and jugular digastric nodes, and rinse, and again back to terminus, face and jaw. Clear terminus again, supraclavicular chain, spinal accessory chain, jugular chain, water wheels, submandibular, submental, mandibular node, rinse, and again proximal to distal and back again. Parotid nodes, proximal to distal, rinse, back to terminus again. Deep abdominal, clear terminus, cisterna chyli. Cisterna chyli, it can be also in inhalation and exhalation. External iliac nodes, and also all the time we should push up, the stroke should be toward the cisterna chyli and also toward the lymph flow pathways. Inguinal nodes and rinse again. We rinse back again to the terminus. Lower quadrant or lower abdominal and lower limbs. Again, we start by clearing the terminus, cisterna chyli, inguinal nodes, popliteal nodes, work proximal to distal as a general rule. And upper quadrant or thoracic and also upper limbs. Again, we start by clearing the terminus, axillary node, external mammary nodes, brachial nodes, and cubital nodes, and working proximal to distal and rinse again. Results. The right shoulder a bit lower than left shoulder, high ilium on the left on a standing and seated. No lymph node enlargement were detected. If we find any kind of the enlarged lymph node, so we should avoid it, because you know that as a general rule, the lymph node should not be enlarged, or it should not be very tangible. The client has referred to family doctor and has done a medical lab workout has been done for her, and all the results were normal according to her family doctor, and no pathogen was found. And this was her first time that she has referred for MLT treatment. Client stated an improvement in her immune system by feeling more energetic and also more concentrated on her projects in the company. The follow-up session was arranged for 1 week later on. Discussion. We all know that in the modern life, stress is very common and inevitable in daily life. Stress is the mother of disease, which reduces immune system response, and according to the finding, it also lowered or reduced the lymphocytes numbers or count. In order to get a better response, we all need to have a balanced life and also good nutrition along with the treatment. The elements affecting treatment outcomes can be the expertise and years of experience of the therapist, and also being well trained. According to results following treatment session, client seems to have received benefits of the treatment or manual lymphatic therapy. Conclusion. Improvement in client's immune system resulted in better performance and daily function, and client was able to concentrate on her project more effectively and shows more competence in dealing with her kids' puberty challenges. Obviously, more studies should be done to validate and verify the efficacy of this treatment for the client. The references that which I used were MyCleve, clevelandclinic.org, and also helio.com and medicaltoday.com. Thank you.